Welcome to 2-Minute MRCP. Today we'll review Crohn's disease. Crohn's disease is a type of inflammatory bowel disease that can affect any part of the gastrointestinal tract, from the mouth to the anus. However, it most commonly affects the terminal ileum and colon. The exact cause is unknown, but there is a strong genetic predisposition. Unlike ulcerative colitis, inflammation in Crohn's disease involves the full thickness of the bowel wall, extending from the mucosa to the serosa. This transmural inflammation explains why patients develop strictures, fistulas, and adhesions. About 80% of patients have small bowel involvement, usually affecting the ileum. Around 50% ileocolitis, and 20% disease confined to the colon. Perianal disease occurs in approximately 30% of patients. Crohn's disease typically presents in late adolescence or early adulthood. Presentation may be nonspecific symptoms such as weight loss and lethargy. Diarrhea is the most prominent symptom in adults. Patients with Crohn's colitis may develop bloody diarrhea. In children, abdominal pain is often the dominant feature. Perianal disease may present with skin tags, ulcers, or fistulas. Extra-intestinal manifestations are more common in patients with colitis or perianal disease. Investigations typically show raised inflammatory markers, increased fecal calprotectin, anemia, and low vitamin B12 or vitamin D levels. C-reactive protein correlates well with disease activity. Colonoscopy is the investigation of choice. Typical findings include deep ulcers and skip lesions, meaning areas of diseased bowel separated by normal bowel. Histology demonstrates inflammation throughout all layers of the bowel wall from mucosa to serosa and may reveal goblet cell, non-caseating granulomas. Small bowel enema is high-sensitive and specific for examination of the terminal ileum. It may show strictures producing Cantor's string sign, proximal bowel dilatation, rose-thorn ulcers, and fistulae. Management begins with lifestyle modification. Patients should be strongly advised to stop smoking, as smoking worsens Crohn's disease. Some studies suggest an increased risk of relapse secondary to NSAIDs and the combined oral contraceptive pill, but the evidence is patchy. To induce remission, glucocorticoids are usually first line. Budesonide may be used in selected patients. Enteral nutrition is particularly useful in children. Mesalazine can be used but is less effective than steroids. Enteral feeding with an elemental diet may be used in addition to or instead of other measures to induce remission, particularly if there is concern regarding the side effects of steroids. 5-ASA drugs, for example mesalazine, are used second-line to glucocorticoids but are not as effective. Azathioprine or mercaptopurine may be used as an add-on medication to induce remission but is not used as monotherapy. Methotrexate is an alternative to azathioprine. Infliximab is useful in refractory disease and fistulating Crohn's. Patients typically continue on azathioprine or methotrexate. Metronidazole is often used for isolated perianal disease. For maintaining remission, stopping smoking is a priority. Azathioprine or mercaptopurine is first line. Thiopurine methyltransferase or TPMT activity should always be checked before starting these drugs. Methotrexate is used as second line if thiopurines are unsuitable. Surgery is eventually required in around 80% of patients. Common procedures include ileocecal resection, segmental bowel resection, and stricturoplasty. For perianal fistulas, MRI is the investigation of choice. It can be used to determine if there is an abscess and if the fistula is simple or complex. Patients with symptomatic perianal fistulae are usually given oral metronidazole. Anti-TNF agents such as infliximab may also be effective in closing and maintaining closure of perianal fistulas. A draining seton is used for complex fistulae. For perianal abscess, requires incision and drainage combined with antibiotic therapy. A draining seton may also be placed if a tract is identified. Major complications for Crohn's disease include small bowel cancer, colorectal cancer, and osteoporosis. And that's your quick review of Crohn's disease. If you found this helpful, don't forget to like, share, and subscribe to 2-Minute MRCP for more quick revision videos.